I want to talk with you today about something you may have never heard of, and it's a DCR procedure, which stands for dacrocystorhinostomy. The last part refers to the nose, because what happens is a brand new tear duct is created through the nose, through here, through your nose, and that's how you have to have tear ducts. So this happened to me, and I wanted to talk with you about it. If you have dry eyes and your eye doctor's talking to you about getting punctal plugs to put into your tear ducts, what I would be asking that provider is, what kind of plugs are these? Is this temporary? Is it permanent? Does it have a stopper at the end so it won't migrate and then get trapped in here? It's a really important question, because for the rest of my life, I have to have probing and irrigation and newly made tear ducts. I had to have surgery and have these tear ducts created. A lot of people have dry eye syndrome, whatever you want to call it, and they get treated with prescription medication, prescription drops, or just lubricant eye drops, and then sometimes that just isn't enough. So eye doctor might recommend punctal plugs. Punctal plugs are these little either collagen or silicone type of material that is inserted here into 2 or 4 of your tear ducts. Now, punctal plugs can be intended for temporary use or for permanent use. I had them inserted in 2 of my tear ducts, and the one question I had to him was, so what happens if I don't want them in here anymore? Can you take it out? Well, no, because these don't have a stopper on them, so I can't really pull it back out, but it'll go through. If it gets dislodged, it will go through your system and then go through your body, and that will be that. So I said, okay. So I had them put in, and pretty much within no time, immediately, they dislodged, which is what I feared would happen, and it did. So they set up house in the lacrimal space and created an infection. But I was working as a nurse in pediatrics, and there I was trying to just do my job, but now they're blocking everything here. So all this tearing is tenfold and coming straight out. It has nowhere to go. So it just falls out of your eyes all day long. So I left that eye doctor who couldn't help me. He said, you need to go to an oculoplastic provider. I found that surgeon. So when I found the oculoplastic surgeon, he said, before I go in and do surgery and try to dig them out and remove them, let's try a couple different things, probing and irrigation. So I said, okay. So that's where they numb your eye the best they can with eye drops, and then they go in with what looked to me like a long metal paper clip, like if you unwound a paper clip, and this goes in and digging and poking and trying to probe and move it along. That comes out, and then a syringe with a tip at the end full of, I believe it was normal saline, but now I hear you can use water because I have to get irrigations for the rest of my life, and that's what he uses. So then that goes in, and he's pushing pretty hard to try again to flush this through, but it didn't work. Everything just came out forward. And the only other option would be to re-irrigate again, and then if it doesn't work, we're going to have to do surgery and do what's called a DCR procedure and build new tear ducts. So I said, okay, please schedule me. And the resident said, why would you want to go do that? Why would you want to hurry up and go in and have a surgery? It impacted my job. So he scheduled me for surgery, and I got that surgical procedure done on one eye first, and it worked beautifully. The thing is, again, though, this is a new tear duct for you. You don't get to have your old tear ducts in the way they once worked. So now, before you can sort of test everything out, you're going to have a stent in place. It's going to be a material, like it feels like plastic, and this tube is put through the canal that they worked on tied, and that stent's in place for several months. In my case, for that particular one, it was 3 months, and I just remember the nasal cap, it's just like your nose gets mine did, super congested. I've got this tube up in there. If you have any deviation, you're not going to have much room. When you blow your nose, it comes out your eyes, right? That's your new reality. So anytime you have a cold, a cough, congestion, you're going to blow your nose, you're going to sneeze, anything like that. Or anytime I wear my glasses and something's going on with my nose or I blow, it's all on my glasses. Isn't that gross? Yeah, I agree. But that's what I have now. I needed the other side done, and that particular surgeon retired, and there was no other oculoplastic surgeon in his place. So I found somebody else who took my insurance. And have you ever, any of you ever watched Nip Tuck years ago? You can still see it, I think, on Hulu. Well, go look up Nip Tuck, because that's how I felt like his clinic was. Then I thought, well, am I just being too sensitive about it? Maybe they're perfectly fine. They just all remind me of this, including the two surgeons. Which I question, are you really an oculoplastic surgeon or you just, anyway. Plastic surgeon's office, I go in, it's Nip Tucksville. I see him. He looks like the men on Nip Tuck. He schedules me for surgery, and I just should have known right there, because I went back into surgery with my regular old street clothes on, and even though the probes were on and we were in an open bay, all of us who were having outpatient procedures that day, my first DCR I had in a hospital. Now I go into this outpatient clinic, going for this outpatient procedure, and I had nothing but complications afterwards. Extreme eye pain, just a lot of complications. It came time to now cut that stent and pull it so that, I could have a new tear duct. But when I went in a few months later, he cut the stent, he pulled it, and it immediately collapsed. See, you just should know. You get a gut feeling about something. So now I had to have what's called a revision, which is a redo. I had to have a revision. I found a surgeon in Seattle who was an oculoplastic surgeon. He did this in the hospital. He could do a revision. I scheduled with him. He did it, and he said, this time we have to really get this right, because we can't keep going in and trying to rebuild tear ducts because of the scar tissue, and the percentage of it working is going to go down each time we go in and mess with it. I'm going to, work through your sinuses a lot this time. So I went in, had the surgery that morning, and it was in a hospital, and he did a beautiful job, and he's an excellent surgeon, Timothy Carey, up in Seattle. I did have a lot of unusual sinus pain when I was in recovery. He didn't want me to go home with all that pain here. Nothing was working in recovery, so he said, I'm going to go do my other procedure. I'll be back. He came back in, and then he gave me a block into a nerve into my cheek. And so what's the bottom line here? Ask questions. If you want to go ahead and go through with getting punctal plugs put in for dry eyes, then ask your eye provider all those questions. Can it migrate? Can it move around? What would happen if it gets stuck in here? If they say it'll just work its way out, that's not necessarily true. If they say there's new punctal plugs on the market, that is true. So ask if you're getting the newer type of plug or plugs. You can put them, in all four areas. Ask that. Am I getting 1, 3, 4? And something to keep in mind is if you do need, heaven forbid, but if you do need a DCR procedure and have new tear ducts made, make sure you go to a board certified oculoplastic surgeon. And ask a lot of questions there too, but that's what they specialize in, among other things, but that's who you have to go to, and they see this all the time. The first one I had done, he said, this is what keeps me in business, are all these punctal plugs getting lodged in here. And now new ones have been made, new devices to put in as plugs so that this doesn't happen as often, but is it 100% foolproof? I don't know. it's your risk to take if you want to go that route. But just be aware and ask questions, and I hope that this was helpful. If you like this kind of content, medical stories, information made easy about different medical procedures, then please consider subscribing. It's totally free. Like and subscribe. Thank you.